Hi, welcome back to Park Parent Pointers. If you didn't check out my videos from last week, we touched base on feeding instructions, post-op care in regards to pain medication, surgery check-in times, all that good stuff. So go ahead and check those out. This week we pick apart why your son might have been told that his type of hypospadias repair requires 2 surgeries to complete, while someone else's child might have been told 1 surgery. So I kind of want to touch base first by saying hypospadias is a very common penile birth defect. About 10,000 little baby boys are diagnosed with hypospadias in the U.S. each year. So it's nothing that you did wrong. It's nothing that could have been helped. Something if you eat different or you do this differently. It's just a common birth defect that's similar to cleft lip that can be surgically repaired. The 2 biggest ways that we kind of decide how a patient is, or how many surgeries he's going to have, is the ventral curvature, which means the curvature underneath, and where the urine opening is. And I say that because there are some patients that might be diagnosed with distal hypospadias, which means the opening is closer to the head of the penis, but might require 2 operations, and I'll kind of dive into that. So 10% of distal hypospadias patients and nearly a third of proximal hypospadias patients have ventral curvature of less than 30 degrees. While about half of our proximal hypospadias cases have greater than 30 degrees. And I mention that because curvature is the most important factor in correcting your son's hypospadias. Vast majority of patients with less than 30 degrees of curvature can be surgically repaired, and 1 surgery called the TIP, that type of repair can be done for patients with less than 30 degrees. While patients that have more than 30 degrees, regardless if they were diagnosed with proximal or distal or wherever your urine opening is, will require a 2-stage STAG, S-T-A-G repair. And so that's important to keep in mind because there are a bunch of different types of hypospadias. I have these here, but the biggest factor is the degree of curvature. So the opening could be closer to the head, like the glandular, subcoronal distal, could be in the middle, like the mid-shaft, or lower, like the proximal variance, penoscrotal, or perineal. This is just as important as curvature, but curvature is what we look at the most, especially for our patients that the location of the head might be closer to the top. I know that's something parents always wonder is, I was told distal, that's usually, on the blogs it says one surgery procedure, but that's not always the case because ventral curvature is what we look at the most. Of course, everything is case by case. Nothing is black and white. It depends on previous surgeries, what was done in those surgeries, it's very specific to your son. So of course, if you have any questions, you can go ahead and reach out to our office. Our doctors, both Dr. Snodgrass and Dr. Bush, will reach out to you via email free of charge. We don't bill your insurance, we don't bill you. We want to make sure that you're getting the right information out there. Park Urology is more than happy to help you out, even if you don't have surgery with our office. We just want to make sure you're getting the correct information. Check out next week's video. Super excited. We're going to talk all about each individual surgery and what to expect post-op. See you next week.